Pain. So what is pain? Everyone in their lives in some point has faced this kind of problems. Pain which is not relieving and that is causing hamper in their quality of life. So how do we treat the pain? Let's know it today. Hello, my name is Dr. Manish. I am a pain and palliative care specialist currently working in Narayana Superspeciality and Narayana Multispeciality Hospital, Howrah. So pain is an experience, it's a sensory and emotional experience, and it's a bitter experience, it's not a very pleasant experience. Why it occurs? Due to some tissue damage. It can be directly associated with some tissue damage or resembling that of a tissue damage. So there may be an injury, there may be an trauma, following there may be a swelling, a redness, and that can cause a type of pain. So this is called an acute pain. And another is the chronic pain, which is a long-term pain, like a pain which is lingering for more than 3 months and a year in the back, in the knee, in the shoulders. This is called chronic pain. So this is one kind of classification. Another is nociceptive, neuropathic and nociplastic pain. So nociceptive pain is what? Again, a kind of trauma, following a trauma or a fracture or a injury, there will be swelling and redness. It can be seen in uric acid, or it can be seen in patients suffering from rheumatoid arthritis, where there is a swelling of the fingers, the toes, there will be redness. This is a nociceptive pain. Another is neuropathic pain, where there is a origin is from the nerves, right? So it can be due to anything compressing on the nerves, like in the back there may be a sciatica. The term is called sciatica, where the back pain radiating towards the leg pain, neck pain radiating towards the hands and the limbs. Another is nociplastic pain, where there is a mixed kind of pain. There is altered nociception, right? So it is a kind of pain where you will find no injury, no trauma, yet the patient is suffering from pain all over the body. So one example will be fibromyalgia. So another thing, there is numbness and tingling below the hands and the feet. Those again become parts of the neuropathic pain. Okay. So how will we diagnose and how we manage it? So if any kind of pain, first we have to check the history and examination. We see you in the OPDs, we examine you, and then we come to a clinical diagnosis, right? Then after that we go for the different kind of tests. So what are the different kinds of pain from head to toe? So it may be headache, it may be a facial pain which is due to trigeminal neuralgia, it can be a neck pain, radicular pain, it can be a pain in the shoulders, it can be a frozen shoulder, it can be a pain in the elbows, it can be pain in the wrist, the back, the knees, the ankles, the feet. So everywhere there are different kinds of pain. It can be plantar fasciitis, it can be a knee osteoarthritis, it can be a back pain which is not relieving due to medications, even not requiring surgery, and it can be a kind of trigeminal neuralgia and a facial pain also. So this is the spectrum of pain we treat, and to diagnose it, obviously you don't have to go to a pharmacy and take a medicine, because there is no diagnosis there. You are taking a medicine and you are relieving pain, and the source stays there. So yeah, you are not controlling the source of pain by taking medicines from over the counter, and without knowing the source, it might hamper your other functioning of other vital organs. It can be the lungs, it can be the heart, it can be the kidneys, and it can be many other things, because taking medicines can hamper your kidneys. So those has to be taken into account. You come to a pain physician and let them know what is the problem you are facing, and will help you diagnose your source of pain. It can be from the bones, the muscles, the joints, the ligaments, the tendons, the nerves. There are lots of sources, but we need to channelize our forces to know the point where is the pain coming from and diagnose it, and then some tests are done and then some medicines are given. So first what we do in management, first obviously a period of rest is there. Obviously after falling down, after a trauma, we give cold compressions, and for chronic pain we give cold and hot compressions, which is called contrast bath, and we give some medicines according to the pain. Nociceptive pain, one kind of medicine, neuropathic one kind, and nociplastic one kind. So to know what kind of pain that is. And then after that, if the pain is relieved, we continue to tell you that you do an exercise regularly. If there is a pain during exercise, those medicines are there for the pain to be controlled, and you continue exercise lifelong, which is the long-term treatment of any kind of pain, right? So if there are some side effects, if the pain medicines are not that much effective, then we can do some injections. Those injections are part of my domain, where we actually give injections in case of back pain, we give injections in case of shoulder pain, and in knee pains also. There are some intra-articular injections inside the joints. Previously it was steroids, now there are new injections coming in, and the nerve injections also there. There are also pain injections in case of back, in the joints, and also near the nerves, and also for the shoulder under ultrasound and C-arm guidance inside the OT. And the patients actually get the benefits of pain relief for a longer term, and also with the reduction of pain medicines and avoidance of surgery where it is not needed. Obviously, when there is a need for surgery, go for surgery, but there is not a need for surgery, this unfit for surgery, in that case these methods come into play. And coming to palliative care, so palliative care is a kind of approach, like a kind of approach in patients and their families who are suffering from life-threatening illnesses. So we try to improve their quality of life. So how it is done? So it's a team approach. We have a doctor, a physician, obviously palliative care physician, a nurse, a physiotherapist, occupational therapist, a social worker, a volunteer, and a psychologist. And they all form a team to see the problems the patients facing. So that is it can be cancer, it can be a lung problem, a kidney problem, a liver, or any neurological problem, or any gastrointestinal problem. Any kind of problems long term that can be treated by us, our team. So how it is done? So we actually take the history, early diagnosis, what is the problem he is facing on, and what is the problem other than physical. That is, there is some spiritual, there is some social, and there is some psychological problems. So knowing a long-term life-threatening illness, patients get anxious, they get depressed, and they also have a loss of income, so loss of job. So how to manage that? How to whom to go for that? So we come into play to know your problems, try to help you out, both controlling your pain, your physical symptoms, and other social psychological problems also. Rather than taking medicines over the counter, a person suffering from these kind of problems, chronic pain and other life-threatening illnesses, please do consult a pain and palliative care physician nearby to get the benefits of this service, so that you can lead a good quality of life. Thank you. Stay well.